Hello and welcome to today's Here's to Your Health podcast and videocast. My name is Don Luensmann. I'm Executive Director of Marketing and Development for Crawford County Memorial Hospital in Denison. My guest on the program today is Dr. Leslie Eiland. Dr. Eiland is a Board Certified Endocrinologist for Diabetes and Metabolism. She's a graduate of the Emory University School of Medicine and completed her fellowship in endocrinology at the University of Nebraska Medical Center. She's headquartered at Nebraska Medicine in Omaha and provides outreach services to a number of hospitals in rural Nebraska and Iowa, including Crawford County Memorial Hospital. And that is a mouthful, Dr. Eiland, but that is exactly what it is that you do. And we're so grateful for your services that you provide here at CCMH. Welcome.
Thanks so much for having me today.
So what we're going to talk about today is thyroid awareness. And I would say that probably for a lot of people, they have kind of an idea of what a thyroid is, but they're not really quite sure exactly what's going on there. And we're talking about endocrinology. So why don't we start by just briefly telling our audience what the endocrine system is and what it does.
Sure. So it's a pretty broad, disparate system that involves organs kind of throughout the body. The majority of what we see, or what I see as an endocrinologist, is people with diabetes, both type 1 and type 2 and gestational diabetes. That's maybe about 50% of what I do. But the rest of what I do deals with other endocrine organs, right? So the pituitary gland, the bulb-shaped gland in the middle of your brain, people with pituitary tumors, people who have damage to their pituitary, so they need hormone replacement therapy. I deal with a lot of people with thyroid disease, so a thyroid that is underactive or overactive, thyroid nodules, thyroid cancer. I deal with disorders of the adrenal gland, so like adrenal insufficiency or adrenal nodules that may or may not be making too much of a type of hormone. We deal with osteoporosis and calcium and bone disorders, so it's pretty broad. I love it because a lot of it is pretty chronic, so you get to follow patients over a long period of time, and it's treatable too, right? We can replace or block anything that we need to, so outcomes are generally good, and it's pretty varied. We get to see people with different ages, with lots of different comorbidities.
You know, the thyroid is what we're talking about today. And I know that you don't have to have one in order to be alive, but I know that if you are alive and your thyroid is not doing what it's supposed to do, it can make you pretty miserable. So what is your thyroid gland and where is that located?
Yeah, good question. So it's a butterfly-shaped gland at the base of your neck. So the top half may kind of poke out right over your collarbones, and the bottom half is usually buried under there a little bit. And then when you swallow, it will rise and fall. So it's located right in the front of the neck, towards the bottom. And its job is to make thyroid hormones, which are secreted into the blood. And they have many different effects, but they control our kind of energy balance. They contribute in some part to weight, but that's certainly more complex than just that. They regulate our temperature, help with brain function, heart function, muscles, and really just keep organs working as they should.
You know, we hear about hypothyroidism and hyperthyroidism, and they're not the same thing. They're actually the two opposite ends of the scale. When your thyroid is not operating properly, you either have hypothyroidism or you have hyperthyroidism. Can you just tell us what the difference is between those two?
Yeah, sure. So hypothyroidism is when your thyroid gland is not producing enough thyroid hormone. And if it persists long enough, you need to be treated with thyroid hormone, which is an inexpensive medication that you take one pill once a day. Hyperthyroidism is where the gland is making too much thyroid hormone, and that can be due to, a couple different things. Kind of the three most common would be like a brief inflammation of the thyroid, like a thyroiditis. Sometimes you can have a Graves' disease where it's an autoimmune condition where the whole gland starts overproducing thyroid hormone, or sometimes you can have a nodule on your thyroid that starts churning out too much thyroid hormone.
My guest on the podcast and videocast today is Dr. Leslie Eiland. She's a board certified endocrinologist at the Nebraska Medicine in Omaha. Dr. Eiland, when we talk about thyroid stimulating hormone or TSH, how is that measured and what should the target number be for folks?
Yeah, good question. So it's a blood test. Doesn't matter what time of day you get it done. You don't have to be fasting for it. It's a pretty straightforward blood test that is done in-house at most hospitals and clinics. And it's a little bit counterintuitive in terms of what the result is when somebody is hypo or hyperthyroid. So TSH stands for thyroid stimulating hormone. It's made by the pituitary gland, right, in the middle of your brain. And its job is, it does what its name implies, right? It stimulates the thyroid to make thyroid hormone. So if your thyroid is not making enough thyroid hormone, which is T4 and T3, mostly T4. If your thyroid is not making enough T4, then the pituitary cranks out more TSH to try to stimulate your thyroid to make more thyroid hormone, right? So some people say, I don't know why I'm here, but my doctor said my thyroid was low. Well, it's kind of opposite. So when your thyroid is underactive, when you are hypothyroid, your TSH is actually elevated. The opposite, right? If your thyroid is making too much thyroid hormone, there's a negative feedback that goes to the pituitary to shut off the TSH. So kind of like a heater and a thermostat, right? And so when your thyroid is making too much, your TSH is low. So hyperthyroidism, low TSH, hypothyroidism, high TSH, for the most part, for the majority of circumstances.
That's interesting. I did not. You just educated me because I did not know that. That is a very interesting. I mean, I knew hypo versus hyper, but
Right.
not exactly how that would affect your TSH level. So, in addition to the TSH level, what ought we be paying attention to when it comes to our thyroid?
Yeah, so for the most part, TSH alone is great for an initial screening lab. And if your doctor's getting that, annually with your healthcare maintenance labs, that's usually good enough, and you can move on. In people who have established thyroid disease, for hypothyroidism, still TSH is most important. Occasionally, we will get a lab called a free T4 value, which is the actual thyroid hormone. Not usually as reliable as the TSH, and that's still kind of the most important lab that we're paying attention to help adjust your medication. When you are hyperthyroid, we will get some additional tests like beyond the TSH. So we will get that T4, free T4 level, and we will often get a T3 level as well to see just how hyperthyroid are you. So for screening purposes, TSH alone is good, but if you have established thyroid disease, we may check those additional levels, plus occasionally a thyroid antibody, especially in the setting of hyperthyroidism.
My guest on the podcast and video cast today is Dr. Leslie Eiland. Dr. Eiland is a board certified endocrinologist at Nebraska Medicine in Omaha. And finally today, Dr. Eiland, I want to talk a little bit about thyroid cancer. And there are lots of different reasons that people have their thyroid removed. Unfortunately, thyroid cancer has touched our family. I had a sister-in-law a little over a year ago who was diagnosed with thyroid cancer and then later passed from that. So let's talk just a little bit about thyroid cancer. And, is that something that people ought to be checked for?
So for the most part, people with thyroid cancer have normal thyroid blood tests and usually don't have a lot of symptoms, right? We are finding it more and more, right? The incidence has been increasing. I think over the last few years, it's actually plateaued a little bit. And that can be due for a couple different reasons. I think there may absolutely be some environmental or exposures that are increasing the incidence that we don't know a whole lot about yet. But the majority reason for why we're seeing so many more thyroid nodules and in turn diagnosing people with thyroid cancer is that we're just imaging people so much more now, right? People are getting carotid ultrasounds to screen for plaque, and they accidentally, or not accidentally, but they, incidentally find a thyroid nodule. People are getting a CAT scan or an MRI of their head, their brain, and they're going down a little bit further into the neck, and they're finding a thyroid nodule. So we're doing so much more imaging than we were doing before. And so we're finding a lot more thyroid nodules. About less than 10% of thyroid nodules actually are thyroid cancer, but the more nodules you find, it makes sense that the more diagnoses of thyroid cancer you will find. For the most part, and I'm so sorry to hear that this was not the case for your family member, Thyroid cancer is often treated by thyroidectomy alone, by surgery alone, occasionally with radioactive iodine for more aggressive forms. And people, the outcomes are quite good overall, right? People are more likely to, mortality levels are low and have been very stable. And people are more likely to die with thyroid cancer than from thyroid cancer.
Well, I appreciate your time today, Dr. Eiland, and for filling us in a little bit on thyroid awareness. My guest has been Dr. Leslie Eiland. Dr. Eiland is a Board Certified Endocrinologist for diabetes and metabolism. She's headquartered at Nebraska Medicine in Omaha, and she actually provides services here at CCMH. So if you ever have a question about your thyroid or any other part of your endocrinology system, you're certainly welcome to give us a call, and we will make certain that we put you in touch with Dr. Eiland.
Absolutely.
I'm Don Luensmann. I'm sorry, go ahead, Dr. Eiland.
I will say one more thing. I think the thyroid and the internet are a little bit terrifying, right? And there's a lot of misinformation out there. And so the website I tend to tell my patients about or find the most helpful is thyroid.org. It's the website of the American Thyroid Association, and it has really nice downloadable brochures and patient pages and frequently asked questions. So I would probably start there.
Oh, very good. Thank you very much. So that is the end of our podcast and videocast today. My name is Don Luensmann. I'm Executive Director of Marketing and Development for Crawford County Memorial Hospital. We care for life.